Now, we have had so many lessons about inflammation, about healing, all that one. Now, let us look at the molecular cellular point of view. How does cells of the body respond and adapt to various injuries, to various inflammation, to various change in the environment where they are? So we'll check on how they adapt because they have to survive or they are defeated in that type of environment. Now, what is cellular adaptations? These are reversible changes in the size, number, phenotype, metabolic activities, functions of the cell in response to change in the environment they are in. So the cells must constantly adapt under normal conditions to change in the environment where they are. So these physical adaptations usually represent a response to cellular normal stimulation by hormones or something like endogenous chemical substance. For example, enlarged breast and induction of lactating in the breast by pregnancy, that one is because of the hormones which are preparing this mammary gland for the major functions of providing milk. So they have to change to this in the preparation of this major activity in the body. So there are various types of adaptations. There is those we call them pathological adaptations, and we have cellular adaptations. So pathological adaptations may share the same underlying mechanism, but they provide cells with the ability to survive in the environment and perhaps escape an injury. So in cellular adaptations is a state that lies in the middle between the normal and unrestrained cells and the injured or overstressed cells. So there is various types of cellular adaptations. The cells can go hyperplasia, and these ones you'll see them one by one. They can go hypertrophy, the cells can go atrophy, the cells can go metaplasia, or the cells can go dysplasia. So this is an example of various cells. You can see in the middle of that diagram there is the normal cell of the bronchial epithelium. Those are the cells of the respiratory system. Now you see the cells with some cells organelle there. You can see the rough end of the diagram smooth. Then you can see that it is atrophy. The cell has become small. In atrophy, the cells become small, and in hypertrophy, the cells become big. That is diagram number 2. Diagram number 3 is hyperplasia. The cells multiply. Now, in diagram number D is that the cells changes in the morphology. So the cells, you can see now the shape of the cell has changed. And then in the cell, in dysplasia, the cell organelle becomes big. So those are the 5 types, in simple way, that's the 5 types of cellular adaptations pathologically, and also some of them are physiologically, and we will see one by one. Now, let us look at hyperplasia. Now, this is an increase in number of cells in an organ or tissue, which may increase in volume. So you can see an example this is an example of a uterus, a gradular endothelial hyperplasia. This is a uterus which has increased. The walls of the endometrium has increased in the number of cells, either any form of stimuli, either hormonal stimuli. So types of hyperplasia can be either physiological types of hyperplasia, and for example, it can be either hormonal and be influenced by various types of hormones in our body, like hyperplasia of the femoral breast epithelium, but or in pregnancy, so that the mammary gland can prepare for major functions like breastfeeding. So there is another hormonal influenced type of hyperplasia, which is the uterus pregnant, during pregnant, the uterus becomes big. No, in normal endometrium after normal menstruation, during the menses, the endometrium also increases. So there is a hyperplasia of the cells of the material so for the purpose of preparation of implantation in case a sex and embryo is formed. Then the uterus is ready to do what? To prepare for implantation. Now, the other one is prostatic hyperplasia in old age. That is for the purpose of men. Prostate becomes big in old men, and then this is the cases of where people have this problem of blocked urine. So then there is number two, which is called compensatory types of hyperplasia. And these are physiological types of hyperplasia. So in hyperplasia, which occurs because of compensatory, is follows various removal of various organs or part of the body, or collateral organs like regeneration of the liver following a partial hepatotectomy, regeneration of epidermis after skin ablations following an nephrectomy. On one side, there is a hyperplasia of nephrons of the other kidneys. So let us see the other types of hyperplasia, which is pathological. So in this type of pathological, there is excessive stimulations of hormones or growth factor, which, for example, in endometrial hyperplasia, there is a hood healing of granulation tissues due to proliferation of the fibrous tissues and endothelial cells. There is a skin wart from hyperplasia of epidermis due to human papilloma virus. So there is pseudocarcinomatous hyperplasia of the skin. Now, let us look at the other one, types of cellular adaptations, and this one is hypertrophy. So what is hypertrophy? The hypertrophy is the increase in size of the cells and the change in just as increase in the size of the organ. These types can be either physiological, and the physiological types of hypertrophy is there is growth of uterus during pregnancy, involves both hypertrophy and hyperplasia. And also there is another one because of pathological causes like increase in workload, hormonal stimulation, and growth factors. Stimulation like hypertrophy of heart, the most common stimulus during chronic hemodynamics overload is a pathological type of hyperplasia or hypertrophy. Now you can see that is an example of hypertrophied heart from the Robbins Basic Pathology 2003. It's an example of that one. You can see the heart tissues, the chambers are very small because the heart is already hypertrophied. So the chambers are very small and the tissues are big. So there is another one which is called physiological hypertrophy of the uterus during pregnancy. That is number one. You can see the number one is that it's a big uterus because of what? Because of pregnancy and gross appearance of a abnormal uterus. Is B. That's how it is B. But you can see number C is a gravid uterus. You can see the cells are big because they have to enlarge. They have to enlarge. So the relationship between hyperplasia and hypertrophy is that although hypertrophy and hyperplasia are two distinct processes, frequently both occur together and they will be triggered by the same mechanism. Now, let us look at atrophy. Atrophy is acquired loss of size due to reduction of cell size or number of parenchyma cells in an organ, and typically physiological or pathologically. And for example, this is an example of atrophy. The left heart, the other one is the right normal right. The left one is normal heart. The other one is the atrophy. That means the cells become small, small. So physiological types of atrophy, this one like the brain, a number of processes of aging in tissues which could be due to loss of endocrine stimulation or atherosclerosis takes place, which cause to atrophy of the lymphoid tissues in the lymph nodes, appendix, and thymus. Atrophy of gonals after menopause, and atrophy of the brain and during aging process. So in this case, this like atherosclerosis in the brain can cause what is called vascular dementia, which it is a little bit difficult to differentiate it with Alzheimer. And sometimes it is also called, in the recent years, it has been started being called diabetic type 3. Now, then there is atrophy of the lymphoid tissues in the lymph nodes, appendix, and thymus. Then atrophy of the gonads in the menopause. That means now the woman will stop having the secondary characteristics like menstruations, the menopause, all those types of things. So let us look at pathological atrophy. Pathological atrophy is, for example, starvation, ischemic atrophy, disease atrophy, neuropathic atrophy, endocrine atrophy, and pressure atrophy, and idiopathic atrophy. These are the examples of pathological atrophy which take place. So let us look at metaplasia definition. Metaplasia is a reversible change in which one adult cell types is replaced by another adult cells. For example, change in environment, division, or inflammation and nutrition causes. So let us look at types of metaplasia. There are basically two types of metaplasia: epithelial metaplasia and mesenchymal metaplasia. So in this epithelial metaplasia, there's squamous metaplasia like change in bronchus, uterus, and cervix, gallbladder, prostate, and renal bladder. Vitamin A deficiency squamous can cause squamous metaplasia in the nose, bronchi, and renal tract, lacrimal, and salivary glands. So columnar metaplasia can lead to intestinal metaplasia in human and chronic gastric ulcers and Barrett's esophagus. Because of my the Barrett esophagus occurs as excessive production of acid in the GIT jar, then resulting to hyperplasia to prevent the acid from destroying the raw GIT, the raw esophagus. Then we have mesenchymal metaplasia, like osseous metaplasia and the cartilaginous metaplasia. So this is an example of squamous metaplasia in the bronchus. In the bronchus, you can see the cells have metaplaced, many of them. Then we have the other one is basement membrane. You can see schematic diagram of a columnar squamous metaplasia. You can see the junctions of the normal columnar epithelium basement membrane and the subcells squamous metaplasia. You can see how it is. Then we have the other one is dysplasia. Dysplasia is the disorder in cellular development, also referred as atypical hyperplasia. Epithelial dysplasia is characterized by cellular proliferation and cytogenic changes, resulting to increase in number of layers of epithelial cells, disorderly arrangement of cells from basal layers to the surface layers, loss of basal polarity, resulting to nuclei lying away from the basement membrane, cellular and nuclear pleomorphism, and increase in nuclear cytoplasmic ratio, nuclear hyperchromatism, and increase in mitotic activities. The two most common examples of this plastic change are the uterine cervix and the respiratory tract system. The difference between metaplasia and dysplasia is what? The difference is that in nature, the metaplasia is defined as change of one type of epithelial or mesenchymal cells to another type of adult epithelial or mesenchymal cells. So in the dysplasia, there is a disorder in cellular development may be accompanied with hyperplasia or metaplasia. So, for example, in types, the epithelial, in the metaplasia, the epithelial, which is the squamous, columnar, or mesenchymal cells of, like, for example, osseous and cartilages. But in dysplasia, it is purely epithelial cells. So the tissue affected is most commonly affected is the bronchial mucosa, uterine and cervix. Other mesenchymal tissues is like cartilages and arteries, whereas in dysplasia is the uterine, cervix, and the bronchial mucosa. So the cellular changes in mature cells development, metaplasia, and in dysplasia is disordered cellular development like pleomorphism and nuclear hyperchromatism, mitosis, loss of polarity, And naturally, history is that reversible or individual of stimuli, that is metaplasia, comes to normal. But in dysplasia, many regression or removal of the exciting stimuli or may progress to higher grade of dysplasia or carcinomas in situ. And that is the end of this lecture about cellular adaptations. The reference for you to study more about this one is in the book of Robinson's Basic Pathology 8th edition, or Aston or Mohammed, a textbook of pathology 6th edition. Also, you can get some reference from Kara of Atlas of Pathology. Thank you very much for listening to this one, and it's going to be something good for you so that you can be able to, when you do dissection on your cadaver, you can be able, or when you are talking about the clinical perspective, you can be able to understand what is a problem with your patient. Thank you very much. Keep in touch, keep on the channel so that you can be able to understand and learn more out of this. Thank you very much.